The procedure for donning and removing personal protective equipments, PPE. First, prepare all the necessary equipments and supplies. Gown, mask, eyewear or a face shield, and a clean gloves. Wash hands before the procedure. Pick up a clean gown and allow it to unfold in front of you without allowing it to touch any area soiled with body surfaces. Locate the armhole and slide the arms and the hands through the sleeves. Fasten the ties at the neck to keep the gown in place. Overlap the gown at the back as much as possible and fasten the ties or the belt. Using a forceps or spiral forceps, the nurse will swing and the nurse assistant will tie the belt. To have the nurse at ease during the procedure. And next, hold the mask by the two top strings or loop. You have two options, a string mask or a loop mask. Hold the mask by the top of the loops. Wear the mask only once and do not wear any mask longer than the manufacturers recommend or after it becomes wet. Do not leave a used mask hanging around the neck. Next, put the protective eyewear or a face shield. The nurse is now going to proceed with the glovings. If wearing a gown that is tied at the waist in the back, pull a gloves. The first glove completely pulled off by inverting a roll and rolling the gloves inside out. Do the same with the other hands. And now the nurse is fully equipped with the personal protective equipments, such as the gown, the mask, the face shield or the eyewear, and the gloves. It is now about time for the nurse to remove the PPE after the procedure. To remove soiled personal protective equipment, remove the gloves first since they are almost soiled. If wearing a gown that is tied at the waist and the back, undo first the ties before removing the gloves. After untying the ties at the back, remove the first glove by grasping it on its palmar surface just below the cap, taking care not to touch the inside part. It must be only gloves to gloves. Pull the first glove completely up by inverting or rolling the gloves inside and out. Continue to hold the inverted gloves by fingers or removing the glove hand place. Do the same thing on the other hand, for the second hand. Pull the second glove off to the fingers by turning it inside out and putting it or discarding it in a container. And then the nurse will proceed with hand washing. After hand washing, remove the mask. Securely remove the mask from the face. If the side loops are present, lift the side loops up and away from the ears and face. Discard the disposable mask in the waste container. Wash hands again if they are become contaminated by accidentally touching the soiled part of the mask. Remove the gown when preparing to leave the room. Then, please be reminded that unless a gown is grossly soiled with body substances, no special precautions are needed to remove it. If a gown is grossly soiled, avoid touching soiled part on the outside of the gown if possible. To remove the gown, grasp the gown along the inside of the neck and pull down over the shoulder. Roll up the gown with the soiled part and discard it in the appropriate container. Remove the protective eyewear and dispose of properly or place in an appropriate receptacle for cleaning. Wash your hands again. And that completes the procedure for donning and removing the personal protective equipments.